Osteopaths are trained to evaluate the individual person and their specific needs in relation to the complaints that they present with. To support that, I think it's helpful for you as a patient, potential patient, to appreciate what you might expect when you come to visit the osteopaths and how that supports your care. Before you come to an appointment, the first thing to do is to think about why you're coming. In this instance, it's about being clear about what's wrong, what you think may have caused the problem that you've developed, and also try and understand what it is that it limits you in doing. So, for example, whether that's movements or activities such as sports or gardening, things that you enjoy doing. It's also helpful to think a little bit about other medical conditions that you may have, for example, if you're diabetic or you have a heart condition, so that we are able to fully understand your presentation when you come and for you to be clear in your mind about what's bothering you most. When you attend the osteopaths, we typically will need to examine you at some stage. So before you come, it's worth thinking about what you're going to wear. Normally, most patients like to wear either loose-fitting clothing so that we are able to move the patient freely without clothing hindering their movements, and light clothing, so things that are fairly thin or light as opposed to heavy jeans, which makes it very difficult for us to examine you. Some people prefer to wear sports clothing like tight-fitting t-shirts or gym leggings. Either way, whatever you feel most comfortable with. And if you have any doubts about what to wear, you can ring the clinic and we can talk to you about that. When you come, we like to make sure that we explain to you precisely what you can expect during your appointment. So once we've welcomed you into the clinic, we will take you into one of our treatment rooms where your practitioner will sit down, detail what you can expect from your first appointment, and from there we will start the process. We initially begin with an extensive case history taking. This takes about 15 to 20 minutes, and it allows your carer to get a very clear picture of what's caused you to come to visit us. We will ask you questions to understand the background to the problem, the triggering factors, the things that may also contribute or maintain the pain that you have, and how you feel it's limiting you in your day-to-day activities. Once we've got that information, we'll also ask you questions about your general health. This is to help us understand if there are any other factors that might be relevant to your problem, but also factors that might influence what we're able to do in terms of treatment. Once we have all this information, your practitioner should have a pretty good understanding of what's wrong, and they will then be able to discuss that with you. We will talk about the possible causes of your pain and what that might mean. And also, in some instances, these symptoms may indicate that you might need to be seen by another medical practitioner, such as your doctor or an alternative practitioner. And if that's the case, we'll discuss that with you, and we sometimes refer patients at that stage to see other practitioners for further investigation and treatment. However, if your problem is something that we think we can help with, the next stage is to examine you. This will involve us asking you to do day-to-day activities such as bending, twisting, and different movements of your body depending on where your problem is. And this will highlight activities that might cause you pain or trigger discomfort, as well as things that you feel limited with. We will also use a range of special tests that we do, which are very reliable in helping us identify the cause for your pain and also establish if there are any other areas of your body that may be limiting or influencing your problem. We sometimes also undertake more medical examinations, such as taking your blood pressure, listening to your breathing, or checking your nervous system. This helps us, again, to clarify symptoms that may be presenting and to make sure that your pain is musculoskeletal in origin and not related to another part of your body. Once we have all of this information, we will be much more confident in what your diagnosis is, and from there we can either refer you if needed or move forwards to treatment. But at every stage we will explain to you what we're finding and what that means in terms of your problem, and then in terms of how we will be able to care for you. If you are comfortable to progress from that point in the assessment process, we will start the treatment. Now, osteopaths use a wide range of manual techniques. These include soft tissue massage techniques, articulation techniques, which involves moving joints around, stretching, manipulations, which are the sort of clicking techniques that some people are familiar with, and a whole range of other things. Before we perform any treatment, we will explain to you what we're going to do. We will ask for your consent, and to do this, we will explain the risks and benefits that come from treatment so that you can make an informed decision about whether or not you want us to proceed. We will make use of a range of techniques, as I've said earlier, as part of the treatment process. And towards the end of the session, we will typically talk to you about further care. And this might include how many osteopathic appointments you might need in the future. Typically, our patients need between 4 or 5 treatments, but sometimes that can be less or more depending on the nature of your problem. So we will make sure we explain that to you so you've got a good idea of how many appointments you may expect to attend for. We also try and provide you with exercises depending on your ability, and these are designed to help with continuing the treatment process outside of the treatment room. We'll hopefully be able to explain them to you whilst you're at the session, and we will send you an email with your exercise program attached, and this allows you to see videos and read written accounts of each exercise in turn, so you can make sure that you're confident in doing the exercises properly at home. Once we've completed that process, we will arrange a time for you to return, typically a week later. And at that appointment, which is a 30-minute appointment, we will reassess you very quickly. Make sure that there's, if any concerns have popped up in the interim, we answer those for you. See if there's any progress or change in your symptoms, and from there continue the treatment process. And we routinely review progress to make sure that things are improving. And if things aren't changing as we would expect, we will discuss that with you. And again, we might consider further referral for further assessments if we feel it may be necessary. But we will try and keep you informed and involved in your care at all times so that you feel confident that what we're doing is in your best interests.